It is common to hear of people having high blood pressure. I'm sure you have heard the term before, but what does it really mean? Blood pressure is the pressure or force of blood in the blood vessels as the heart pumps blood around the body. Blood pressure is highest in the arteries and lowest in the veins. Measuring blood pressure is a tool that we use to help identify if someone is at high risk of heart disease. The higher the blood pressure, the higher the risk. Think of blood pressure as being like the pressure in a garden hose when watering the garden. Turning on the tap is like exercising. The more the tap is turned on, the greater the flow and the pressure in the hose being the arteries. If there happens to be a kink or a blockage in the hose, the flow of water slows, the pressure builds up and can even push back against the tap, or in this case, the heart. When there is a thickening of an artery due to plaque being stuck on the artery walls, there is a buildup of pressure which can lead to high blood pressure. People are categorized into blood pressure classifications according to their readings. Blood pressure readings are taken using an instrument called a sphygmomanometer. Say that 10 times fast. And is recorded in millimeters of mercury. A normal reading is around 120/80. The top number is always the systolic reading and the bottom number is always the diastolic reading. Prehypertension, hypertension being the fancy word for high blood pressure, is about 120 to 139/80 to about 89. Stage 1 hypertension is about 140 to 159/90 to 99. And stage 2 hypertension is greater than 160/100. For our purposes, anything over 140/90 is considered high blood pressure and would require a medical clearance from a doctor to exercise. If a client with hypertension has been cleared to exercise, there will be some lifestyle modifications that they will need to apply, as well as some exercise modifications from you as a trainer. On the flip side of the coin, some people have low blood pressure, or hypotension, and that is normally anything around 90/60. These people are at low risk of heart disease, and all you need to be aware of is that they may experience lightheadedness and dizziness when changing postural positions. During exercise, blood pressure will naturally rise, and it is important to understand that different types of exercise will affect the blood pressure slightly differently. Resistance training will increase blood pressure substantially, as will compound exercises and anything where the weight moves above the head. Steady state exercise, such as jogging, will have a more gentle, gradual increase in the blood pressure.